Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. What happens to bone after a tooth is removed? Today we're talking about something most people do not think about until a tooth is to come out. What happens to the bone after a tooth is removed? This is one of the topics that sounds small at first. A tooth comes out, the pain is gone, the infection's gone, you feel better. So the natural thought is, okay, problem solved, we're done here. But your mouth is a little bit like a neighborhood. When one house disappears, the empty lot affects the houses next to it. The grass changes, the fence leans. Someone eventually parks a boat there. Things get weird. A missing tooth can do the same thing. It affects the bone, the teeth next to it, the tooth above or below it. If you bite, you're chewing, and sometimes even the shape of your face over time. So today, we're going to keep it simple. We will talk about what the bone does after a tooth is removed, why timing matters, what replacement options exist, and why dental implants are often the best option that act most like a natural tooth. And yes, we're going to talk about bone. I promise not to make this sound like a college anatomy lecture. No pop quiz, no microscope. No one has to spell osteointegration, unless they really want to impress someone at a party. First, let's start with the big idea. Your jawbone is not just a rock sitting under your gums. It's living tissue. It changes based on how it's used. When a tooth is in place, the root on the tooth sits inside the bone. Every time you chew, tiny forces travel down the tooth root into the bone. Those forces tell the body, hey, this is bone being used. Keep it here. It's kind of like a muscle. If you use a muscle, your body tries to keep it strong. If you stop using it, it can shrink. Bone works in a similar way. It needs a job. When a tooth is removed, the root is gone. That part of bone no longer gets the same chewing signal. So the body starts to reshape the area. Reshaping is normal. It is not because you did anything wrong. It's just how the body heals. The socket where the tooth used to be fills in with a blood clot first. Then new tissue forms, then bone slowly fills in. That sounds great and is part of healing. But at the same time, the outer shape of the ridge can shrink. The ridge is the bone under the area and under your gums where the tooth used to sit. A simple way to picture this is to imagine a tent pole. The tooth root is like the pole holding up the tent. And when the pole is removed, the tent fabric can collapse inward. In the mouth, when the tooth root is gone, the gum and bone can lose some width and height. This is why missing tooth space can look normal right after an extraction, but months later, it may look sunken in or narrower. Now, how fast does this happen? A lot of the bone change can happen in the first few months after a tooth is removed. The body is healing and the remodeling happens quickly during that time. Bone can continue to change more slowly after that. This is why I like patients to at least have a plan before a tooth is removed, even if they are not replacing it that same day. Planning early doesn't mean you have to rush. It means we think ahead. It's like packing for a trip. You don't have to leave today, but it's nice to know where your shoes are before you're already late and standing in the garage with one crock and one snow boot. When we know a tooth needs to come out, we can talk about whether a bone graft makes sense. A bone graft is a material placed into the socket after the tooth is removed to help preserve the shape of bone. It does not magically create brand new bone overnight, but it can help maintain the ridge so there's a better foundation for a future implant or other replacement. I often explain it this way. If an implant is like building a fence post, the bone is the ground. You want good ground before you place the post. Now, let's talk about what can happen if a tooth is removed and not replaced. 1, the teeth next to the space can drift or tip. Teeth like to touch other teeth. When a space opens up, the teeth beside it may slowly move into that space. 2, the tooth above or below the space can move too. If you lose a lower tooth, the upper tooth that used to bite against it may start to grow down into that empty space. It is not really growing like a plant, but it can slowly move because it no longer has a tooth to stop against. 3, your bite can change. One missing tooth may not seem like a big deal, but chewing forces shift. Other teeth may take more pressure. This can lead to wear, cracks, soreness, and problems over time. 4, chewing can become harder. Most people can still chew after losing one tooth, especially if it's a front tooth. They often start chewing more on the other side. That puts more work on the remaining teeth. 5, the bone and the gum shape can shrink. This can affect future options. The longer a space sits empty, the harder it may be to replace the tooth later without extra steps. So what are your replacement options? There are 4 main paths. Option 1 is do nothing. Sometimes this is a reasonable option, especially for a short time or in certain situations. But doing nothing is still a choice, and it can have effects. The space does not freeze in time. The mouth keeps changing. Option 2 is a removable partial denture. This is a tooth replacement that comes in and out. It can replace one tooth or several teeth. It is usually less expensive than an implant or bridge, and it can be a good option for some patients. The downside is that it's removable, it may feel bulky, and it does not replace the tooth root. Option 3, there's a bridge. A bridge is fixed in place. It uses the teeth on each side of the missing tooth as supports. It can look very natural and work well. The downside is that the support teeth usually need to be shaped for crowns, even if they're healthy. A bridge does not replace the missing tooth root. Option 4 is a dental implant. A dental implant is a small titanium or ceramic post placed into the bone. It acts like an artificial tooth root. After it heals and connects with the bone, a tooth can be attached to it. This is why implants are often my favorite long-term option when the patient is a good candidate. An implant replaces the root area. It does not rely on shaving down the neighboring teeth. It is fixed in place. It can feel like and function like a natural tooth. At Wahpeton Family Dentistry, we place and restore dental implants in our practice. That means we can often help patients through the process from planning to placement to final tooth. I am also an associate fellow in the Academy of Implant Dentistry, or AAID. I mention that not to sound fancy, but because implant dentistry is an area where training and planning matter. Implants are not just put a screw in and call it a day. That would be like saying building a house is just put some wood in a rectangle. There's a lot more to it. We look at the bone height and width. We look at the gums. We look at nearby teeth. We look at health history. We look at smoking or vaping. We look at diabetes control. We look at the space. We often use 3D imaging to understand the area more clearly. A good implant plan starts before the implant is placed. Here's a simple timeline for many implant cases. First, we evaluate the tooth and the area. Can the tooth be saved? If not, what's the best way to remove it? Should we graft the socket? Is an implant right away possible, or should we let it heal first? Second, the tooth is removed. If needed, a bone graft may be placed to preserve the ridge. Third, the sites heal. Healing times vary. Some are faster than others. Some need more time. Fourth, the implant is placed. The implant needs time to integrate to the bone. This process is called osteointegration. There, I said the big word. It basically means the bone grows and locks around the implant surface. It is the body's way of giving the implant a firm handshake. Fifth, we restore the implant. That usually means placing an abutment and a crown, which is the tooth you see and chew with. Now, not every patient can have an implant the same way. Some people have plenty of bone. Some need grafting. Some have medical factors that need to be managed. Some have a bite that puts force on an implant. Some people grind their teeth and their jaws are basically doing CrossFit at night without permission. That does not mean they can't have an implant. It just means we have to plan carefully. Let's talk about a common question. If I already lost bone, is it too late? Not always. Many patients who have been missing a tooth for years can still have an implant, but the plan may involve more steps. If the ridge is too thin or short, we may need to do grafting or other treatment to create more foundation. Sometimes an implant is still straightforward. Sometimes another option makes more sense. That is why an exam and imaging matter. Guessing from the outside is like trying to judge the plumbing of a house by looking at the front door. You might have an idea, but you really need to look inside. Another question, does an implant stop all bone loss? An implant can help maintain bone in the area because it gives the bone a job again. But it's not a force shield. The mouth still ages, gum health still matters, cleaning still matter, bite force still matters. Bone around the implants also get inflamed or infected if plaque is not controlled. So an implant is a great tool, but is not a free pass to ignore flossing forever. I know, this is very disappointing. Dentistry refuses to let floss retire. Another question, what if I do not care about the space because no one can see it? That's fair. Not every missing tooth is a cosmetic issue. But back teeth are chewing teeth. Losing a back tooth can affect how you chew and how you put pressure throughout the mouth. It can also affect future treatment options. So, even if no one sees the space, your other teeth know it's there. Another important question, what if I'm nervous about implants? That is normal. Most people are nervous because they imagine the worst version of the procedure. They picture a construction zone. They picture a Home Depot aisle. They picture me walking with a tool belt saying, "Good news, I watched a video." That is not how this works. Implants are planned. The area is numbed. We used imaging. We go step by step. Most patients are surprised. The process is more comfortable than they expected. Many say the tooth removal was more noticeable than the implant placement. The goal is not to pressure anyone into an implant. The goal is to explain the options clearly so a patient can make informed decisions. Here's the main message I want you to remember. When a tooth is removed, the bone starts to change because the root is gone. That change is normal, but it matters. The sooner we make a plan, the more options we have. If you're told a tooth needs to come out, ask the questions. What happens if I don't replace it? Am I a candidate for an implant? Should we have a bone graft at the time of extraction? How soon should we replace the tooth? What are the pros and cons of an implant, bridge, partial denture, or do nothing? What would you recommend if this were your tooth? The last question is one of my favorites. It helps turn the conversation from a menu of dental words into a real plan. At Wahpeton Family Dentistry, our goal is to help patients understand what is happening and why it matters. If a tooth needs to be removed, we do not want you leaving the room with only half the information. We want you to know what happens next, what the bone may do, and what replacement options fit your goals. And if an implant is the right choice, we can often place and restore the implant right here in our practice. So to wrap this up, missing teeth are not just empty spaces. They are areas where the mouth begins to change. Bone needs a job. Teeth need neighbors. Your bite needs balance. And the best time to talk about replacement options is usually before the tooth comes out, not years later when the bone has already packed up and moved to Florida. Thanks for listening. This is Dr. Mason Haley with Wahpeton Family Dentistry, where our goal is to take the fear out of dentistry and help you make informed decisions about your oral health.